The Democratic Republic of the Congo, a nation grappling with poverty and political instability, found itself battling a new adversary in early 2025, a mysterious and deadly illness. The outbreak began in Boloko, a small village nestled deep within the Equateur province. The dense rainforests of the DRC, teeming with diverse flora and fauna, have long been recognized as a potential hotspot for zoonotic diseases. The current outbreak serves as a stark reminder of the delicate balance between humans and the environment. The first victims of this unknown illness were 3 young children. They had consumed meat from a bat carcass, a common practice in the region. Within days, they were dead. This tragic event marked the beginning of an outbreak that would quickly spiral out of control. As the death toll climbed, panic and fear gripped the local population. The mysterious illness announced itself with a terrifying swiftness. Victims experienced a rapid onset of symptoms, often succumbing to the disease within 48 hours. The speed at which the illness progressed pointed towards a highly virulent pathogen capable of overwhelming the body's defenses before a robust immune response could be mounted. This aggressive nature set alarm bells ringing in the medical community, raising concerns about its potential to spread rapidly and cause widespread fatalities. Initial symptoms mirrored those of many common infectious diseases: fever, headache, chills and cough. As the illness advanced, it unleashed a cascade of more severe symptoms, including diarrhea, neck stiffness, and unexplained bleeding. The presence of hemorrhagic symptoms such as blood in vomit and stool further heightened concerns, suggesting internal bleeding and organ damage. This constellation of symptoms pointed towards a serious threat to public health, demanding immediate attention and swift action. Health authorities faced a formidable challenge in identifying the cause of the outbreak. The remote location of Boloko, coupled with limited healthcare infrastructure, made it difficult to collect and transport samples for testing. This logistical hurdle hampered initial efforts to pinpoint the source of the outbreak, allowing the disease to spread unchecked during the crucial early days. Time was of the essence, and the lack of resources and infrastructure in the affected region made the task all the more daunting. Initial tests ruled out Ebola and Marburg viruses, 2 notorious hemorrhagic fever pathogens endemic to the region. While this offered a glimmer of hope, the mystery surrounding the causative agent deepened. Further tests revealed that some patients had also contracted malaria, a common occurrence in the region. However, the severity and rapid progression of the illness suggested that malaria was not the primary culprit. Researchers began to consider other possibilities, including viral hemorrhagic fevers, bacterial infections, and even food or water poisoning. Regarding the world's awareness of this disease, news of the outbreak sent shockwaves across the globe. The world watched with bated breath as the death toll continued to rise in the DRC. The specter of a new infectious disease, potentially as deadly as Ebola, emerging from the heart of Africa, sparked international concern. Memories of the devastating 2014 to 2016 West Africa Ebola epidemic, which claimed over 11,000 lives, were still fresh in the minds of many. The World Health Organization, along with other international health organizations, sprang into action, mobilizing resources and dispatching expert teams to the DRC. The WHO classified the outbreak as a public health emergency of international concern, signifying the seriousness of the situation and the need for a coordinated global response. After the global authorities became aware, containment became the top priority. Health authorities implemented a multi-pronged approach to curb the spread of the disease. Isolating suspected cases emerged as a crucial first step in breaking the chain of transmission. Makeshift isolation units were set up to separate the sick from the healthy, preventing further spread within the community. However, limited healthcare facilities and a shortage of trained personnel posed significant challenges. Contact tracing, a labor-intensive but effective method, was employed to identify and monitor individuals who had come into contact with infected persons. This involved interviewing patients and their families to retrace their steps and identify potential exposures. However, the remote location and the reluctance of some individuals to cooperate with health workers hindered these efforts. is important to notice that the outbreak in the DRC served as a stark reminder of the interconnectedness of human, animal, and environmental health. The consumption of a bat carcass, a practice rooted in local customs and traditions, highlighted the risks associated with human-wildlife interactions. This incident underscored the fact that zoonotic diseases, those transmitted from animals to humans, pose a significant and growing threat to global health security. Several factors contribute to the rise of zoonotic diseases. Deforestation, driven by logging, mining, and agricultural expansion, brings humans into closer contact with wildlife, increasing the chances of pathogen spillover. Climate change further exacerbates the situation by altering the distribution and behavior of animal species, potentially pushing them into new areas and increasing the likelihood of contact with humans. Although at first glance there is no room for panic, the 2025 Congo outbreak holds valuable lessons for global health security. First and foremost, it underscores the importance of investing in robust public health systems, particularly in low-income countries. Strengthening surveillance systems, improving laboratory capacity, and training healthcare workers are crucial steps in ensuring early detection and rapid response to outbreaks. Secondly, the outbreak highlights the need for greater international cooperation and collaboration. Sharing information, coordinating research efforts, and providing technical and financial assistance to countries in need are essential for preventing and controlling future outbreaks. International organizations such as the WHO play a vital role in coordinating these efforts.